evening. This is Trillium Creek Spotlight with Paige, our patient here today, who has really had a miracle in skin healing. So Paige came to us March 5th, and she started getting a rash on February 5th. Never had a rash like this before, and it started 2 months after she had her booster. She had her vaccines, and then she had her booster in December, and exactly 2 months later, she is starting to break out all over. So tell us your experience with what happened.
On February 5th, I woke up and I was like, from my shoulders, my arms, my stomach, my back, my thighs were covered in a red rash. And I had thought it was because I used a lotion that I was allergic to. So I cut that lotion out. I, kept doing different things, trying to get my skin back to normal, avoiding that lotion. Well, then about 3 weeks later, all of a sudden I got this rash on my hands, and I'm like, okay, so this is not a normal rash. So I scheduled an appointment with Trillium Creek, and then all of a sudden my lower calves broke out in all these big, red, ugly sores. And so when I came in, you looked at me and you said, this is psoriasis. So and I've never had any of that ever in my life. None of my family members have it, so yeah. I don't know where it came from.
Yeah. So fortunately, we know that there's a lot of data, a lot of patients, and a lot of cases where we have induced psoriasis, not only with the vaccine, but also when you have the COVID itself. So we can get new onset of psoriasis from either the disease or the vaccine. So Paige was a classical example of psoriasis induced by the vaccine. We gave her a medication called Cosentyx when she was here a week ago, and a topical cortisone to help her ease the itching and the rash. And then tell us what happened. Today is a week later.
A week later, and I am 99% cured. I still have a few little dark spots on my bottom of my legs from where the plaque things were, but I'm hoping in time they'll just fade.
That'll fade.
So
yeah, remember the legs, the further you are from the face, the skin heals slower. So the legs always is slow. So everything starts to heal. Her hands look amazing. Yeah. You can see just the redness, all right? The body looks amazing, the legs look amazing, but the ankles are going to take another week or two. So Paige will get 2 more shots today, and we're hoping, because it was induced by the vaccine, as we clear this, she won't need any more medication. We're hoping that will be the case. But she's clear, she's happy. Remember, you can get rashes from any vaccines, whether it's your flu shots, your pneumonia shots, the COVID. You can get rashes, a lot of different types. So we're happy.
Yeah, it was classic psoriasis. When I started looking at it, it's like everything that happened, it was exactly that.
Yeah. So we're very pleased. She is much, much better with her symptoms. So
yes.
Yeah. All right. Thank you.